Like it? You like it a lot? Alright, let's make your sweater graph.
Good morning, y'all. Thanks for joining us. Dr. J is currently in surgery right now. This patient is having a rhinoplasty done today. This is Dr. J's only case of the day. Again, this patient is having a rhinoplasty done. So that is a nose job. Good morning. Thanks for joining us. Again, Dr. J is in surgery right now. This patient is having a rhinoplasty done. Let me know how y'all's morning is going. This is Dr. J's only case of the day. This patient came in with a broader, wider nose. Here on the top is their nose, the bridge. And so what Dr. J is going to do for them is just kind of narrow it and give her a nice little tip at the end of her nose. If you guys have any questions about plastic surgery, about this patient's procedures, y'all can leave them here or reach out to us privately. We're also showing this surgery on YouTube as well. So if you would like to see a live rhinoplasty, you can join us over there. Our link tree has our link to our YouTube. If you just click on our link tree, it'll take you to our YouTube. It'll give you an option to find our YouTube, or you can search for it manually at Dr. Jeneby Plastic Surgery. There you can find some of Dr. J's old videos, old lives, and you'll be able to find this live in particular. Dr. Jeneby has a lot of educational and informative videos on his YouTube as well. And so again, for those of y'all just coming on, hope y'all are having a great morning. Dr. Genevive's first case of the day. This patient is having a rhinoplasty done, so that is a nose job. And so we'll be getting as much coverage for this patient's case, as much coverage as we can. As this is Dr. J's only case of the day. We'll be back later this week though. Dr. J has a case tomorrow. It's going to be a tummy tuck in there, so definitely tune in for that. Hey Charlie, thanks for joining us on YouTube. How's it going? How's your morning so far? all just coming on. Dr. J's with his first patient. Of the day, this patient is having a rhinoplasty done, so that is a nose job. This patient has a broader nose here, just a broader bridge. And so what Dr. J is going to do is just kind of slim it down, smoothen the hump right here on her nose, and then at the end, give her a nice tip. That's wonderful, Miss Charlie. What brought you to our live this morning? Glad to have you. Going to kind of reposition a little bit here, trying to get a better angle for our viewers on YouTube so that they can see more clearly what's going on. Bear with me. There we go. That is a better view there for our viewers on YouTube. And again, for those of y'all that come in on our live here on TikTok, we're also on YouTube over there. We get to show the surgery. Exactly. So you can find us on YouTube by hitting our link tree.
Impressed by rhinos.
Yeah, it's always. It is a very fascinating procedure to watch. Again, you can find our YouTube by clicking the link tree and finding the YouTube tab, or you can search us manually on the search bar at Dr. Jeneby Plastic Surgery. You can see some of our old videos there. You guys can see some more educational, more informative videos as well. Or you can just hop on our live.
Great, awesome, perfect.
There we go. What procedure are you guys currently performing? Right, so Dr. J is in surgery right now. This patient is having a rhinoplasty done. So that is a nose job. This patient just has a broader nose, wider bridge. And so Dr. J is basically going to narrow her nose and give her a nice tip at the end of her nose. Let me know if you have any more questions, or if you'd like to see the procedure as well. We're on YouTube showing the procedure today, showing this rhinoplasty. And so a picture is worth 1,000 words. These procedures are really fascinating to watch. And so this is Dr. Genevieve only case of the day, so we'll be here for a little while, probably until the end of surgery, until they're finishing up, just to get as much coverage of this patient's case as possible. Does our clinic ever do tummy tuck on males?
Yes, a lot. More than you would think, actually. Guys who lost a lot of weight, usually they're on Ozempic or they're on a GLP-1, similar.
Yeah, Ringo, we do. If you're interested in getting a quote for a tummy tuck, we'd love to get you in contact with our team. We have a form here that's pinned on the bottom if you're interested in leaving us with your information. And then if you do so, we'll be able to provide you with a quote for a tummy tuck. I love that I was able to see my procedure. Exactly. It's a lot of people are shocked to hear like that we do go live during surgery. However, a lot of our patients will reference our YouTube before they come and have their surgeries, just to get an idea of what's happening in the OR. And even after, they like to go back and rewatch their surgery specifically. So I'm glad that you were able to do that, Miss Melissa. What procedures did you have done? Hey, Charlie.
These done?
Hey, Bugsy. Thank you for liking our live. Hope you're having a great morning. Do we use drains with a tummy tuck?
Yes, it's the best thing for you. We tried drainless. With that fluid, you still get seromas. It gets easier on you long term if you let us use the drain. I know people don't want to use drains, or this is a fad or something, but drainless tummy tucks have their own risk. So I would say that it would be better just to get the drains. They come out in 1 to 2 weeks anyway, and you don't have the buildup of fluid.
Yeah, Charlie. So if you caught any of that, it helps to prevent the buildup of fluid and seromas. Yeah, Charlie, that's a great question. Let me know if you have any more. Let me see here. I'm down 153 pounds, had ESG in 2023, and really want the skin to be removed. Hey, Ringo. Well, that's something that Dr. J specializes in. We see patients coming in all the time that have lost a lot of weight and want just the excess skin removed. But also, once it's removed, they want it to look nice as well. So again, we'd love to move forward and set up a consultation with you to see if maybe you just need a standard tummy tuck or an extended tummy tuck where it goes towards your back. All of that would be figured out during your consultation, during your meeting with Dr. J. Tummy tuck and thigh lift, almost 2 months. I'm still healing. Wow, Melissa. That is a lot. Have you been able to return back to work and start increasing like daily mobility, like exercise yet? Things like that? And again, for those of y'all just coming on, Dr. J is currently in surgery right now. This lovely patient is having a rhinoplasty, so this patient came in with just wanting to aesthetically improve the appearance of her nose, so she just has a broader nose. Dr. J is essentially just going to narrow it and give her a nice little tip at the end of her nose. Doing great, working and light workouts. Okay, Melissa, that's awesome. It sounds like you're healing and recovering wonderfully, so that's good to hear. It's always good. Keep up the good work. And again, if you have any concerns or any problems arise during that recovery process, always reach out. Because we want to make sure that, of course, you're doing amazing and that your body's doing what it's supposed to during that time. love that I have that continuous connection with your team. Nurse practitioner Andy has been great. Well, I'm happy for you. I love Andy as well. She's amazing. Everyone on our team is amazing. They're all very experienced and just great people to work with regardless. So I'm glad that you as a patient had the same experience. We love hearing y'all's feedback just so we can improve and provide a great service to y'all.
Y'all. You know you're in Texas.
Do you say y'all?
Instead of use guys, they say in the East Coast,
Yeah.
use. To y'all. You know McKenna's a Texan.
Yep.
Yep. Yeah. Stay in Texas, aren't you?
What's that? Stay in Texas?
Yeah. You stay?
No, I think I'd like to move to Colorado or.
Come on.
What? Is that okay?
Just kidding. Yeah, Colorado's nice.
It's beautiful.
Colorado Springs is really pretty. Denver,
I really like Denver too.
kind of like, been, ever since they passed the laws for marijuana, Denver's kind of, it's still pretty. It used to be prettier.
Yeah. Well, I just love the outdoors, so that's,
Okay.
yeah, go for.
So Colorado Springs, if you ever go, is where the Olympians train.
Oh, really?
Yeah.
Like
it's
for.
really, like you can go on the training site.
Yeah.
It's really impressive.
That's cool. I didn't know that.
Like their cafeteria has all the food, but above the food has the macros. It's like on the cars.
Oh,
Isn't that impressive?
yeah. You're saying, you just said Olympians, like all Olympians? Or like,
Well,
what do you.
US Olympics.
Okay. I didn't know that.
Yeah.
Very cool.
Very cool, right?
Have you guys been to the sand dunes there in Colorado? The Great Sand Dunes? That's pretty cool. It's just like in the middle of nowhere, you just see all these mountains of sand.
That's
So-
cool.
It is pretty cool.
I've been to Denver, Vail, all the ski resorts. Vail, I think, is the
Denver is my
prettiest.
favorite.
There's a lot to do in it. Kind of like an Aspen.
Yeah.
But Aspen's real expensive.
So is Vail.
Yeah, Vail's kind of expensive. Yeah, you're right.
Do you both like to ski? Really?
I used to ski more.
What kind of slopes are y'all going down?
It's slopes.
Like the green or
I
the
used to do the
blue?
blacks, the double diamonds. I used to be an animal.
Wait, really?
Really? Actually, I was a ski patrol in Virginia. A small mountain called Mass of Nothing.
What?
We used to call it Mass of Nothing. Mass of Nothing. Yes. Yeah.
Dang.
So I was ski patrol, and then at night I would deliver pizzas on the mountain.
Deliver pizzas? It's Philip's birthday?
Yes.
What?
What?
This is Donna's birthday.
He's coming in late, Doc. It's his birthday. Hey. Maybe eat a little of this last night.
Yeah. Él es de nuestro hijito de Jeneby.
I know. Okay. I am.
Let's distract you.
I would have done it. I didn't get the call out, you know. You know, I helped everybody, but I just didn't get the call out. Let's score. No, I think you're good.
No, we'll release right there.
Yeah, I don't definitely. All right, I need another PDF.
Again, hope you all are having a great morning. Dr. J is currently in rhinoplasty done, so that is
Yeah,
a
a little bit
nose
of a
job.
tip projection.
This patient
Just
came
the
in
tip.
just wanting to improve the aesthetic appearance of her nose. She had a broader nose, and she just
She's got a
wanted it
nasty
to appear
pants
more
right now.
narrow.
It's just
There you go. You can put it in.
happen.
Oh, you think?
And Dr. J is going to do that for her, and then
I'll hold it for you.
just
and
give
you
her a
can-
nice tip at the end of her nose right here. So what are you doing right
Right now,
now?
I'm creating a graph so we can put the tip on the graph.
All right, if you guys caught that, Dr. J is creating a graph so he can put the tip of the nose on the graft. We're showing this on YouTube, so if you guys would rather see it than have me explain it, you guys can join us over there. It is linked in our link tree, or you can search for us manually on YouTube at Dr. Jeneby Plastic Surgery. Is it bad to take magnesium oxide prior to surgery?
Magnesium is
It's not very well absorbed. So
Magglycinate is a little bit better, but not the morning up.
Okay, so
Like,
prior.
you should be NPO after midnight except for your life-saving drugs like levothyroxine, blood pressure pills, things like that. We generally don't like anybody to eat anything. Sorry.
So no. Yes, no.
Not the morning of surgery.
Okay. So prior to surgery, Sharon, no. Is it bad? It's just preferred that you don't
We
take
don't like you to
anything.
take it the morning of. We'd like you to be NPO for anesthesia. Are you talking about in general Magox? I think, like Dr. Hernandez said, you may want to check the bioavailability of Magox versus magglycinate. Magglycinate helps with little cognitive function and helps to relax you a bit.
Okay.
So if you're asking vitamin-wise, you can get that information also from the pharmacist. But the morning of, we don't want you to listen to you do that. We don't want you taking anything because NPO after midnight is the standard, so you don't reflux after you get intubated. And that'd be bad because it can go in your lungs. So morning of, just listen exactly what we tell you to take. It's all in your paperwork too.
Yeah, Sharon. So they'll walk you through with what you can and can have prior to surgery. But like Dr. J just mentioned, there is a cutoff period of when you can take anything. So like, again, they don't want you coming in having just eaten or drank like an hour before. So that's just like general rule of thumb. But again, like they would walk you through all of those rules and things that you shouldn't do prior to surgery. Let me know if that answers your question or if you have any more.
Magox, never heard of it. Basically a vitamin.
Okay, well, to add on to that, what about HRT? She has pellets inserted.
We would probably have you not do your next estrogen pellet. You need to be 6 weeks from that first pellet.
So Sharon, if you caught that, Dr. J said they probably wouldn't want you to take that pellet, and you'd have to be 6 weeks from having taken your last or your first pellet. And of course, like mentioned, they're gonna go over before surgery. In advance, they're gonna go over all of your medications, your medical history, everything that you're taking and taking on a daily basis. They're gonna take all of that into account and advise you on what is safe prior to surgery, what you should be doing prior to surgery. But those are great questions. So she says she's 8 weeks out insertion.
Yeah, so if she wants in the next 2 months, we would not let her get another estrogen pellet until
Okay.
she has surgery, and then 4 weeks after that. So this is a good time to get it in the next few weeks then, if she has the time, but we don't like to have pellets. We don't like to have estrogen pellets put in immediately before surgery. They can make clots.
Okay.
It can encourage clotting in your legs. Does that make sense? So she's 8 weeks out. That's
Yeah.
kind of a good time. 3 months out, 2 to 3 months out is pretty nice. Means the pellet is dissolving.
Okay.
Does that make sense?
Yes. Sharon, did you catch any of that? Just to kind of
Basically, we'll tell you all
reiterate.
that. But don't get any more pellets until you have surgery.
Yes.
Even though it's going to make you grumpy.
Uh-huh.
Everybody's like, it makes me grumpy. I
Yeah.
don't do the cut. Well, we're here to make sure you're going to be okay for surgery. Grumpy is secondary. You like this one?
Yeah, so it's recommended for about 2 to 3 months. You've been off of the pellets
Oh, yeah.
and you have your surgery then. And then 4 weeks after your surgery, you can start taking those pellets again. It's basically just to kind of sum up what Dr. J said. Let me know if you caught the meat of what he just said. But in general, again, they'll walk through all of that with you and come up with a game plan, just let you know, like, for your safety, what you should be doing, what you shouldn't be doing before surgery ever happens.
What's that?
And my daughter, the one that has Hashimoto's.
I have Hashimoto's.
You do?
I just treat it with levothyroxine. That's it. That's all you can do.
They're giving her armor.
Armor thyroid? What's more? Take levo. Armor is like a conglomeration of multiple thyroids.
And again, for those of y'all that are just coming on, this lovely patient came to see Dr. J for a nose job, and that is what she's having. So that is a rhinoplasty. This patient just had a broader nose, and so she just wanted to improve the aesthetic appearance of it. So with it being broader, what she wanted is just a more narrow, uniform nose, and with a nice tip on the end of her nose. So that is exactly what is happening. Let me know if you guys have any questions about either rhinoplasties, plastic surgery, or any other services that Dr. J offers.
So armor, huh?
So-
I would go by what they're saying. Maybe the levo wasn't working.
But she was on leave for long.
And
The endocrinologist in Florida.
a little young girl.
This is for my youngest, who is 16-year-old. But I have heard that legal thoracic.
I like levothyroxine. Predictable, FDA approved. Drug.
So safe to have surgery 2 months after pellets.
Yeah, pretty safe. I mean, the
Yeah.
best is to not have any estrogen, but you can't have it like within 6 weeks of 4 weeks of the pellet. So she's getting her odds have improved 2 months out.
Yeah, sure. And so you would get the okay to have surgery 2 months after pellets. 2 to 3 months is what Dr. J said earlier is kind of like advised. And then after surgery, you'd want to wait about
Hey,
4
bro.
weeks.
We're almost done.
Lo único que falta creo que son dos rolls. Creo que es el temperature y el gas. Creo que es lo
Yeah,
único que
Sharon.
falta.
And there's a number in our bio. We'd love to get in contact with you if you have any more questions. Or you can start by filling out this form that's pinned on the bottom. We'd love to get in contact with you. Again, if you have any more questions. But yeah, thank you for coming on and finding our live.
Not bad. Look over here. They're all better, cuter. No, that's just shrink. Yes. Yeah. There's a lot of extra skin. Can't really cut it. Yeah. No, you have to let it just shrink.
You got it, Sharon. Thank you.
Maybe a chrome Cheers.
So are you about to, are you getting close to finishing this patient's rhinoplasty? What are you doing right now?
We are getting close to finishing. That's a really astute observation there. I am closing the inside of the nose
Uh-huh.
and I'm gonna come off of me. He handed it to me. There was no. Get a needle drop.
We are just repositioning here to get a better angle. As you can see there on YouTube, we are coming to the tail end of this patient's rhinoplasty. So Dr. J is about to essentially close the nose up. He's already broken the nose, improved the bridge, essentially making it more narrow. This patient had a wide nose. Anything at home, cleaning, etc. Yeah, Sharon. So after your surgery, you're really not going to want to be doing a whole lot. I mean, depending on what you're having done, but in general, regardless of what surgery you have done, you're really it's advised that you don't really do hardly anything. You know, just taking it easy. Obviously, things like working out, you're not going to want to be doing or moving around too much. It's real imperative that you have somebody to look after you, a caregiver during that time. Is that what you're referencing, Miss Sharon?
You need a caregiver. You can't be by yourself. Very hard.
Yes, exactly. Because you really don't want to be moving around, getting up too much. Obviously, you need to move, but you don't want, obviously, you want your body to recover and you want your body to heal. And it's not going to do that by constantly having to do daily activities. Your body just can't keep up and heal at the same time. And so that is just something that I think a lot of people don't take into consideration.
Is that on Ticketmaster? Biggest scammers in the world, right, Doc? Ticketmaster? It's like eBay.
eBay.
Like eBay for tickets, right? Ticketmaster, they have a countdown clock. You have to get in line, and then if you leave your... Really hard. Now you're going to hear us banging away. That's not the patient. We're making cartilage grafts on the back table. That's not the op. That's just making cartilage crush, called crushed cartilage grafts.
Wow. And where are those going to go? Those grafts?
I put them just to fill in the defects here on the dorsal.
Okay.
You know, see it?
Yeah. Okay.
Really thin. They're going to be really tiny and thin. You don't see them. Really an art.
Yeah. So again, we are finishing up here. Dr. J's lovely patient had a rhinoplasty done. She came in looking for a nose job. And so right now, as mentioned earlier, Dr. Jeneby was making some cartilage grafts out of some of the cartilage that was removed from her nose. And it's just basically finding a place for it in the areas that just have slight defects and whatnot. It's just kind of used and recycled. And so you can see that happening right now on YouTube.
Oh, yeah.
Right. All right, coral micro here.
And so we'll likely get off here in a moment. We've been on the live for about 40 minutes.
Coral micro sheet.
Again, if you'd like to get in contact with our team, love to get in contact with you. You guys can click this form here. We can provide you with a free quote and provide you with more of your more answers to the questions you may have about surgery, pre-op, post-op, you name it. Again, you can click this form here pinned on the bottom of your screen, or it is also linked in our bio. We'd love to hear from y'all. We will be back tomorrow and in the days to come, next week as well. But I hope you guys learned something. And again, thank you guys for joining us. We'll see you